Afternoon, everyone. Thank you for joining us today for the National Hispanic Medical Association's 2023 New York State Virtual Asthma Advocacy Meeting as part of our Amgen Asthma and Hispanic Education Campaign. My name is Dr. Elena Rios, President and CEO of the National Hispanic Medical Association. The NHMA is a nonprofit association representing the interests of nearly 50,000 licensed Hispanic physicians across the country. Our mission is to empower physicians to lead efforts to help improve the health of Hispanic and other underserved populations. And we work with our medical societies, residents, medical students, and all our stakeholders, including our policymakers, and in this case here in New York. We're joined by members of the New York State Legislature, representing Hispanic communities from across the state through the Assembly and Senate. And we are also joined by Dr. Elizabeth Lee Ray, board member of the National Hispanic Medical Association and a partner in the family practice Eastchester Medical Associates in the Bronx, New York. And the purpose of this meeting is to discuss the barriers and challenges that Hispanic patients face when accessing care to asthma treatment, and especially severe asthma treatment, and ways to promote prevention of the underlying health issues. And secondly, our goal today is how to promote the diversity and the increase of Latinos in medicine and in all the health professions who would help to decrease the inequities in our country by being able to better educate Latinos, especially those that have asthma. So our agenda for today is as follows. I will give an overview of the impact of asthma prevalence among the Hispanic community, followed by remarks from Senator Gustavo Rivera, and then some of the staff from the other Senate offices. And I know I have the list of who's here and who's not here. Okay, so I'll be inviting you to speak one by one, and then after their remarks, we'll have Dr. Elizabeth Lee Ray. And then we'll continue the discussion with more staff from the other assembly offices, and also Assemblywoman Jessica Gonzalez Rojas will be joining us. And then we will conclude the discussion by hearing from the director of the State Department of Health Office of Minority Health, Wilma Alvarado Little, about education ideas that she has for diversity. So let me just explain just a brief background, heightened risk factors, that in 2018, 2.3 million Hispanics reported that they currently have asthma. And Puerto Rican Americans had twice the asthma rates as compared to the overall Hispanic population. The Bronx especially has the highest number and the highest challenge for asthma in the country. In 2018, Hispanics were twice as likely to visit the emergency department for asthma as compared to non-Hispanic whites. Again, Puerto Rican children are 3 times as likely to have asthma, and Hispanic children are 40% more likely to die from asthma as compared to non-Hispanic whites. And given that Hispanics face so much barriers to access to quality health care, both financially and non-financially, it's really difficult to treat diseases such as asthma and severe asthma in our communities. And we look to our policymakers for ideas on how to increase access to care and access to culturally competent care, and how to increase more Latinos, especially into medicine and nursing and all the frontline healthcare professionals. Jason? Okay, so I don't see anyone, but I know that Senator Gustavo Rivera is here. Senator Rivera is the State Senate Chairman of the Health Committee. We're very honored to have him. He represents the Bronx area, and I just have to say that he's also a longtime champion of harm reduction policies, and of course, healthcare for all, and his bill that we know is important to increasing access. Senator Rivera.
Salud, doctora. Good afternoon to everyone. It is indeed not just It's a part of the Bronx, not the whole Bronx,
Okay.
but I have a good chunk of it on the north. No worries, in the Northwest Bronx. But I'm certainly I've been a senator for 13 years over there, and I represent those neighborhoods in the West Bronx, the Northwest Bronx, and I'm the chair of the Health Committee in the Senate. But also quite a fan of Dr. Rios and of your organization. So I just will. I'll just speak for a couple of minutes on asthma, since we are dealing with that today. You heard some of the numbers that Dr. Rios kind of outlined, and you obviously have not only it's a particular concern not only for Latinos, but as she pointed out, the numbers among Puerto Rican folks is even higher than that. And when you're talking about children, for example, while apparently 10% of the children in New York suffer from asthma, it actually goes to about 25% of children up in the Bronx. And so that means that the preventive measures that we are talking about are even more critical for the families that I serve. Now, as I said, my district covers neighborhoods that are across the Bronx, from Fordham Road to neighborhoods to the south of the Cross Bronx Expressway and the Major Deegan Expressway. So kind of gives you a hint of why we're talking about the numbers that we're talking about as far as the prevalence of asthma in these neighborhoods. Now, so whether we're talking about indoor and outdoor air pollution, tobacco use, barriers to quality, affordable health care and health coverage, these all represent different reasons why the neighborhoods that are in places like the Bronx, and certainly the Bronx itself, are in the place where they are as far as asthma. So to deal with this, back in 2019, I hosted a roundtable in my district to discuss the causes as well as barriers to care and treatment. And I did that along with my colleague at the time, Senator Kaminsky, who has since retired from the Senate, but at that point was the chair of the Environmental Conservation Committee. And we did that because we know that this is an issue that requires a multi-pronged approach. And so at that roundtable, we discussed environmental stressors in our neighborhoods and homes that contribute to high asthma rates that actively impact New Yorkers. And based on the conversations that we had back in 2019, a few bills came out of that. Obviously, the pandemic was in the middle, so there was a couple of other things that took a little bit more of a priority. But as an example, there was one bill that we were able to pass and get signed into law last year. Actually, Assembly Member Karines Reyes, who was my colleague from the South Bronx, we managed to pass a bill to get it into law that will ensure that rescue inhaler and treatment devices are readily available for life support and emergency assistance in schools, in summer camps, and in many childcare settings through a non-patient specific prescription. And our people are protected from liability when using these devices. And there's other two bills that I currently sponsor, and they were a product of that conversation back there. One of them would include diagnosis of asthma and other respiratory diseases that require rescue inhaler treatment in the statewide immunization information system, so we can keep more track of where these diseases are. And the second bill that would ensure that every health insurance policy includes coverage for the equipment and supplies for the treatment of asthma, not just the drugs, but also some of the equipment that's necessary to be able to treat particular children under 19 years of age. And so we are going to be reintroducing that this year, and those two bills I'm going to be working on. So lastly, I'm just going to wrap up and say that there is certainly I look forward to working along with medical practitioners who serve some of these folks, who recognize certainly the folks that you have from the Bronx would be able to tell you how much they deal with this on a day-to-day basis. And I look forward to working along with you to not only pass these bills, but more importantly, to continue to educate myself about ways that we could legislatively deal with some of this stuff going forward, because ultimately we want children everywhere to be asthma free. And certainly in places like the Bronx, we need to do a little bit harder work to make sure that we get there. But together we will get that done. So thank you.
Oh, thank you, Senator Rivera. And yes, we applaud you for your legislative focus on asthma and all of your other bills, but for this case, this session, asthma, and whatever we can do, we'd be happy to write letter support, be happy to.
I'll take you up on that. I will take you up.
Yeah, be happy to talk to your legislative assistants and about what else we can do. And just to let you know, we are also very interested in the treatment of severe asthma. I don't know if you know, this is a brand new treatments that are available. They're injections and they're biologics, and it's a little bit more, I'm going to say more complicated for those that have asthma and can't get rid of the asthma, and then they become the people that really need extra help. And there is new treatments now that we're very interested in seeing how that can be more accessible to, especially the Puerto Rican community in the Bronx.
Looking forward to learning more about them.
No, be happy to send you more information on that too, but thank you very much. Look forward to seeing you again. And the next speaker we have from Senator Julia Salazar's office, a member of the Health Committee also, is Michelle Castellanos Ojeda, legislative assistant. And
actually, Michelle is my legislative assistant. We are lucky to be joined by my colleague, Senator Salazar.
Oh, my goodness. Okay, I'm sorry. I have that wrong here. Senator Salazar, you are here.
Yes.
Thank you very much. We're very honored to have you here. And I know that you represent Brooklyn neighborhoods. And I think just like the Bronx, many Puerto Ricans live there too and have lots of asthma. So please let us know how we can work with you and hear your thoughts on how we can advocate for asthma.
Absolutely. Thank you so much, Dr. Rios. And I deeply appreciate the National Hispanic Medical Association taking the time to educate the public and bring people together who, clinicians, people who have been dedicated to addressing asthma, particularly in our Latino communities. I represent New York's 18th district, which is North Brooklyn and a little bit of Queens, but it is a majority Latino district, largely Puerto Rican, Dominican, but also, I myself am Colombian American. There's large Mexican American, Ecuadorian, Colombian communities. And we are really in North Brooklyn, a site of environmental justice communities, as well as many of our Latino communities are, who have been disproportionately impacted by environmental crises, by climate change, and by risk factors for asthma, other respiratory illnesses. And as a representative of this community, I have had the honor of working with individuals in our communities who are seeking to address this from the grassroots to policy advocacy, and certainly working with clinicians in our communities so that the solutions that we are seeking to implement are evidence-based and rooted in public health policy. To me, when it comes to a policy related specifically to addressing asthma in New York, and in the communities like ours that have disproportionately high asthma rates, I think of it as a two-pronged approach, broadly speaking. One being public health policy that seeks to prevent asthma and reduce asthma rates by directly addressing risk factors and environmental causes. And secondly, public education about asthma, risk factors, causes, and a primary motivation for that education. It still is prevention, but it's through the avenue of educating and empowering Latino communities and the public. These are really systemic problems, but they cannot be solved solely through the combined effect of individual actions, of course, but public policy that engages and activates individuals in our communities who are the most directly impacted by asthma and environmental risk factors. It really is engaging and activating our communities to address pollution from fossil fuels, for example, that can bring about systemic change. While on the one hand, we are focused on access to care always, we also are looking at this from a public health and environmental health perspective. Dr. Rios mentioned the some really important statistics about how this is disproportionately impacting our communities. A lot of Latino communities face serious health risks caused by air pollution. That's certainly the case for us in North Brooklyn. There is a Superfund site called Newtown Creek that runs along the border of Brooklyn and Queens, where we have seen a lot of activity from the oil and gas industry over the years, and we have unfortunately seen the impact on our communities in particular. Additionally, there are often higher poverty levels among Latinos, generally lower rates of health insurance, which increases the health threats from air pollution in our communities. But the good news is that through education and lived experience, our communities are stepping up and fighting back and taking action, creating plans to try to address these issues and to address the issues from our communities, our communities actually leading the efforts, right? So there is an organization in my community called El Puente, which has, I'm sure you're familiar with El Puente. They have a grassroots campaign called Our Air, Nuestra Aire, which is like a 5-point action platform. It engages elected officials, informs policy, works also with clinicians, academics, artists, and schools to try to address the environmental crisis of toxic air quality in our community. Talking about the impact, such as very high asthma rates, but also engaging the public in air quality monitoring and holistic solutions to try to improve quality of life, access to care, and to try to mitigate the negative impact of environmental and health inequities. So when we talk about access to care in our communities in North Brooklyn, we have safety net hospitals. So it's very important that we go to where our communities are comfortable seeking care, meeting people where they are in order to address these issues. And so we look at this history of inequitable access to quality healthcare, and say, okay, how can we address this through policy? Senator Rivera carries, as our health committee chair, carries legislation called Coverage for All, seeking to ensure that regardless of immigration status, people are able to obtain health insurance in New York State, since right now our undocumented neighbors are unable to actually legally acquire health insurance in New York. So there's some very important systemic solutions that we've been pushing for years, and that I think I'm very hopeful that we'll be able to implement, so that we can improve access to care, particularly for Latino communities, but really for many communities across the state that are dealing with this issue. So I'll leave it at that. But thank you again for giving me the time to talk about this.
Oh, great. Senator Salazar, thank you very much. And we have one of our board members talking next. Don't know if she has any specific questions for you. Dr. Elizabeth Lee Ray is actually in private practice there in the Bronx, but she's very aware of how important it is to have access to care and treatment and education, all the things that you mentioned. So, and we are very interested also in environmental factors, air pollution, especially, and everything else we can do to help you with your focus in your community. So let me have Dr. Lee Ray like to make some comments from the physicians of New York. And Dr. Lee Ray is also part of our chapter in New York, and we do want to get more involved with the advocacy to the Senate and Assembly of this year as people come back from COVID and start focusing on all these other issues too. Liz?
Yes, yes. I'm glad, what I was doing, I was a little late in coming in because I had one of my children. I'm also in school health. And just as I was coming here, one of the kids had asthma. So we had to kind of switch gears and kind of get him situated. So, and I didn't get everything that you said, Senator Salazar, but I totally agree with what I heard. I was going to actually do a little bit of my commentary on what you said. So I'm wondering, should I do that? And not because I believe that everybody on this panel, first of all, I'm really excited and honored to be in the panel with everybody talking on the subject of asthma. That is an important subject matter, and also to kind of give me the opportunity to tell you a little bit of my experiences as a physician caring and treating for asthma patients, so I'm happy about that. I wanted to just also start out by saying that I'm a proud New Yorker, Asian, Chinese, with my roots in the Lower East Side when it was called Alphabet City. I'm a product of the pipeline programs, and I trained in the residency in family and social medicine. And I have been in the Bronx my entire career. That's going on 33 years. And I have also a son with asthma. So these are, this is a topic that's really important to me. I am in private practice along with another board member, Nelly Correa, but I also do, I just joined the Montefiore School Health Program, and it's the first one in Westchester. And there I'm able to provide like comprehensive, honestly, comprehensive care. I have a whole office that lets me do vaccines, lets me do the COVID testing, lets me do, contraception care, just the whole gamut. And so I have my comments at the end about school health, but I just wanted to kind of give you a little bit more about myself. So I was thinking that I was going to talk about what it is for the county of the Bronx. I don't know if I have to give that information because you guys all know the data, and just that I wanted to mention like the Healthy 2020 and now the Healthy 2030, that these are, targets that we, when we're thinking about moving legislation, that we should make sure that those are given considerations, because that's where the money is going to be. Part of the, when looking over the Healthy 2020 and 2030, I see that the emphasis is going to be on asthma education and self-management. And I really believe that for us to really kind of take care of this is through education, and also to learn how they can use their medication. When you go through the data, we know that in the Bronx, like more than 2/3 of the people in the Bronx are going to be poor and are going to have the higher rates of asthma, right? And they're going to die more. And you pointed out, Senator, about the triggers. They end up in environments that are inequitable. The schools are by, the subway or by the bus depot. And the recent vetoes of the bills that went through, was going to call to that. So that's another issue. But I think that we all come and agree that it's the environmental situation that we have to pay attention to as we, try to get a handle on asthma, because it's going to be, the fact that children and adults are still dying of asthma, to me, with all the medications that we have as a doctor, because they don't know how to use it or because they're afraid to use this system because they're not being understood or it costs too much, are issues that for me as a physician matters. So I think what I want to do is go ahead and give you my examples of my experiences of patients. So I picked three that I have many, but I picked three, and I want to indulge myself in telling you them because I think they're stories that can impact how you see this. So I have, my first is a student that aged out of his parents' insurance. He was 26. And he, had what we call moderate persistent asthma. So that means that he has daily symptoms. That means that maybe more than once a night, he's getting up at night, coughing. You know, he has to use a controller that has inhaled corticosteroids. And sometimes he may have to use some prednisone. So that's his story, but he, you know, takes a leave of school and he goes, Dr. Lee, I'm going to go and do some work construction because I can't stay in school. And so there, of course, he's exposed to the allergens, to the dirt, and who knows what, you know, because now he's in charge of, his new job is disposing of the debris in the construction site. So he comes to me with no meds and he comes in wheezing. He had ICU, you know, hospitalization maybe in the past, and he doesn't go to the emergency room because he can't afford it. So it's not, you know, when you ask the question, have you gone to the emergency room? We got to ask, you know, why didn't they go? And so he didn't go because he couldn't afford it. So here I have him. It's like 6 o'clock at night, my office hours. I have to add that I have late evening hours so that my patients don't have to leave work. You know, they can come after work and not have to worry and jumble all of that. And so what happens, I get them really sick because they're not, you know, going to the doctor. But anyway, the way I remedy this is that I do have samples and I work with some pharmacies that help me give, you know, patients some medications. You know, we're using coupon discount cards. I encouraged him to get Medicaid. I told him he's going to need the controller medications. And I tried to get him back to school because I think we don't need another one of us to not be in school. So I encouraged him to do that. And I also spoke to his mother, who gave him one of her inhalers, and he would have access to the nebulizer. So that was one particular case, which is more common than not because we have a lot of our children, because of Obamacare and whatnot, that took care of them up until 26. But then what happens to them after age 26? So that's my first one. My second one is a 55-year-old Hispanic female. She's from DR, and she develops this terrible cough. And she has no prior history of asthma. She works in a nail and hair salon. And, you know, so I talked to her about the job, that maybe she needs to change the job. And, you know, and she also refuses the diagnosis. I have to add that many people don't realize that you can get a diagnosis of asthma at any age. You know, you don't grow into, you know, at any age. And she was one of those that just didn't accept that diagnosis. She said she had no other skills, and she recently immigrated from DR, and she was waiting for her citizenship. And her hope was to one day open a hair and nail salon. And so for her, you know, I thought to myself, you know, she's going to need long-term inhalation of steroids. But it's her passion to do what it was. It wasn't reasonable for me to have to tell her, yeah, you have to leave your job. You know, like, that's unfair. And I think when we think about these targets, and that was a 2020 target, to tell patients, you know, to tell them, you know, you have to leave your job or you have to move as one of the targets. So I felt that that was kind of, she brought that to reality to myself, that that's kind of unfair to ask of someone who doesn't have other means. For her, what we did is I got her to get HEPA filters, you know, in her salon, and to try to limit her exposure. So that's how we dealt with her there. And then my last situation is an 8-year-old Hispanic boy, and he attends after school. And while he's outside, he gets cold and he tells the after school teacher, you know, I'm wheezing and I'm having trouble catching my breath. So the after school teacher, she looks for the asthma action plan, which is another 2020 Healthy People requirement that we should have action plans on all our students as part of the education. But she looks for that and she doesn't find that. She doesn't find a medication form. There's no rescue inhaler. So she sends the youngster back to the playground. What happens? He goes into respiratory distress. So, you know, these are the things that, you know, in trying to help my patients, are some of the issues that are, you know, telling and frustrating, because for me as a doctor, it's not about giving them the prescription only. What do? You give them the prescription. If they don't use the medication or don't have a way of getting it, is really, we all know that that's not medicine and that's not good care. It's not good care that I want to give. So that, you know, were the kind of the scenarios I wanted to give. And I just wanted to, to kind of say that it really is essential that it is an education of asthma and the self-management of asthma to teach, to be able to get better asthma control. I also wanted to try to, as I was thinking about this, to kind of give you what I think would be solutions. Would that be okay to kind of do? So, so some of the solutions that I myself are thinking about is in order to deal with the health disparities, when patients do not trust or feel that the healthcare provider or institutions hear or understand them. And I know this because, both my parents had troubles with that, we have to go back and always deal with the issue of access, the issue of the cost, the issue of time, the issue of language. And we have to understand that I understand that they're unfunded mandates, especially with language, that we have to work a way to circumvent that. I think more and more signage is around, but many of our patients also are functionally illiterate and they can't read. So we have to remember that also. I also find that we should provide support and resources to our community health centers because they are in the target neighborhoods. I think that would decrease the reflex to go to the emergency room if they go. And sometimes I have patients that they prefer to die. Leave me alone, I'd rather die, and I think that those are not acceptable to me. The other thing that I wanted to bring out was that we should improve and ease the application process for kind of like destination for physician shortage areas, because that, I think, another way that we can get doctors to go to areas that need them most. I also think we should fund and support pipeline programs to keep the numbers up and to, inspire and get more students of color to think about going into health professions. I also thought about campaigning on the PSAs on the awareness of environmental triggers. I mean, I think we can do it top up, but I think the kids and everybody goes into social media, they go into everything. And I think if we could work on something that would let them realize, hey, this is bad for you, that maybe that would be a way to also challenge them and educate them without them knowing they're getting educated about the things that are triggering their own asthma. I also think that we should think about the cost-effective solutions and maybe linking with the HEPA filter manufacturers to make it cost-effective and easier to get. And that came because of the landlords and the fire alarms. We got them to do that, and I don't know why we shouldn't, if the apartment is not kept up and there's mold and whatnot, that we don't have them put the HEPA filters, and provide something for them. And then the last point I wanted to make was to continue the funding for school-based programs. So that in a nutshell is what I wanted to tell you in terms of, me and my role.
Liz, thank you. And I know that we have many other doctors in New York that are anxious to help with the politicians' need for more ideas for your policies. So thank you, Liz. I think also, just to let you know, I know that, and you probably know this better than I do about the New York State Medicaid.
Yes.
Senator Salazar or Assemblywoman Jessica Gonzalez Rojas, who I see on the screen, Medicaid changed their policies to allow social determinants of health to be reimbursed, such as for patients that have asthma, their houses can be fixed, improved upon, like, for example, having air conditioning, or like you said, the filters, air filters. And I don't know if people know about that, and I don't know if it's a state issue too, but I know federal Medicaid put that in, and Medicare also, but I think it was Medicare Advantage. But this is something that we need to get out to all our communities too, about the importance of, there's so many, and I'm going to bring up one more time, there's so many new treatments too for asthma. And one of the things we wanted to bring up to you is the new biologics for the injections that take place every 4 weeks for really severe asthma. It's just like EpiPens, right? For people that are having allergic reactions, people need access to these treatments, and it's important that we all share with you how important we think it is. But let me go ahead and introduce Assemblywoman Jessica Gonzalez Rojas, who's here. And I know that you've been working very hard for your communities, and you have a whole lot of communities here: Astoria, Corona, East Elmhurst, Jackson Heights, Woodside, in Queens. But more importantly, I just wanted to say that we've worked together at the national level, and I know you're a champion for everything you do. So Jessica, please let us know how we can help you work on asthma.
Oh, great. Thank you, Dr. Rios, and thank you everyone for being here. I want to give a shout out to my colleague, Senator Salazar. I think Senator Rivera was on earlier. I see my colleague in the Assembly, Assemblymember Burgos, and I think Assemblywoman Tapia is joining us. This is great that you've convened such a large number of Latino elected champions on this issue, because we're ultimately the ones that are going to be fighting for solutions at the legislative level to address the systemic barriers to healthcare. Obviously, healthcare is something that impacts our community at disproportionate rates. I know in my own family, I have my grandmother had severe asthma. I represent a district in which the Astoria portion is located near peaker plants and the Con Ed plants, and that area is known as Asthma Alley. So it's really important that we connect both the environmental justice issues that we're fighting for, right, and understanding how the locations of peaker plants and other facilities that harm our communities are often located in our communities. And that's something that us as a legislative body have been fighting against and looking for better solutions. I'll just talk quickly on a bill I've been fighting for to expand access for our immigrant neighbors. I represent a district that is 62% immigrant. Many of our immigrant communities continue to be left out of healthcare access. There is a bill that I am championing alongside my colleagues here called Coverage for All. It would essentially expand the essential plan that has been established by the Affordable Care Act to allow for those who'd be otherwise eligible but are ineligible because of their immigration status, that their immigration status is literally the only denominator that's rendered them ineligible for healthcare under the essential plan. And this bill would ensure that they're covered, so it expanded eligibility. And as we all know, the essential plan and other forms of healthcare allow for preventative care, allow us to control, asthma and get the necessary medications that are needed to be well. So that's a bill that I'm championing. The exciting thing about that is that it wouldn't actually cost the state anything if we can convince our governor to include Coverage for All in the 1332 waiver to the Center for Medicare and Medicaid Services. There is over $9 billion of unused funds for New York in terms of the federal essential plan. So this is a real opportunity to be innovative. Places like Colorado and Washington State have done it. And we need to ensure that every single Latino, every single person who comes from another country and has established themselves in New York and has contributed to our society has an opportunity to be healthy. It's simply a human right. And I know you know that, Dr. Rios, and all of us here. So that's one thing I'm championing. I have lots of other priorities, but I don't want to take up too much time because I know we have other colleagues here. But I want to really just make the connection between the ways in which our communities disproportionately are impacted by asthma rates, the environmental factors that we're dealing with, and the lack of access. And this would at least reduce one of those barriers alongside many of the other policies that we're fighting for to reduce the other barriers as well. So thank you all for your work, and thank you to all the members of NHMA. I haven't said the acronym in a while, and Dr. Rios, we got to see each other recently, but we're really excited to be back in contact and work together to fight for health access for all community members. So thank you so much.
Assemblywoman, we'd be happy to write a letter of support for your bill and all of the Latino legislators that are with us. We really know we really take pride in knowing that you represent our communities, because you come from our communities and you know what we need. And thank you for taking care of looking at the waiver to add in immigrants. And if there's anything else you can add in for the waiver, please do. And whatever we can do to help.
Yes, thank you so much.
I'll be in touch with your staff and we'll help you out.
Thank you.
And I do have next, we have Assembly Member Kenny Burgos. And Assembly Member, we just met with you last week in Albany. It was great to meet you in person, but we also want to hear your take on asthma, especially in schools, since you're on the Committee on Higher Education. And
Sure.
we want to thank you for your support for the asthma bills that did get passed already, and what you can do next. And like the Dr. Liz Lee talked about her patients and needing help in these schools also. But
Thank you, Dr. Rios. Yeah, thank you so much again for convening this. I mean, to be quite honest, I don't think there's one single, health issue that you can connect with the Bronx more than asthma. I mean, this is a pretty much well-known fact that we have the highest asthma rates in the nation. And when you look at the infrastructure, the history of the Bronx, and how our neighborhoods have been treated historically by our government, it's really not a surprise. When it comes to policy, one big bill that I was really focused on was a bill called the PSY Act. It wasn't my bill, it was Assemblywoman Latoya Joyner, also from the Bronx, but heavily supported. And this bill would basically prohibit any New York City, any New York State public schools from being located within 500 feet of a highway. Unfortunately, this bill got vetoed, and it was really tough to see that happen, because when you look at the numbers, you have, I think, upwards of 375 schools that are within 500 feet of a school now, and 80% of the kids that go to these schools are students of color. And again, these are not shocking statistics. We know good and well, unfortunately, our most disadvantaged neighborhoods, our communities of color, are always getting the short end of the stick. And unfortunately, that results in the healthcare disparities that we see today. But I always tell folks, policy is obviously huge and super important in combating this, but it's not the only way. Another way we can combat this is through investment. And one of the big ways we've been doing it in my district, I tell folks, is this, this crux of 4 different major interstates and parkways. I have the Bruckner Expressway, the Cross Bronx Expressway, the Bronx River Parkway, and the Sheridan Expressway, all within my small assembly district. So you can imagine what the health disparities look like there. But what we've done is we actually have the largest state investment in the Bronx in New York State history, $1.7 billion project that actually works to reinvent the Bruckner Expressway in many ways. Part of it is to ease up traffic flow, but one of the points that I really like was really getting the local truck traffic off of our roads. Where I have the Hunts Point Peninsula, a lot of the 18-wheeler trucks would literally have to come through our local streets and just really poison the air. And what we did was create a special highway ramp that would essentially put them right to the peninsula where they have to go. And once they're done, they leave immediately. So these kind of investments, we have the federal government right now, thanks to Congressman Richie Torres, doing a study on the Cross Bronx Expressway to see how we can actually cap the Cross Bronx because of the pollutants that it puts out on a daily in all the communities throughout the Bronx. So I'm looking forward to, what that study comes to fruition, and how the state and the city can invest to actually make capping the Cross Bronx a reality. Because again, I think, the investments are really going to show, where our priorities are and how we're going to combat these asthma rates here in the Bronx. But again, couple that with the policy, like my colleague just mentioned, and much more policy to come.
well, again, Assemblyman Burgos, thank you very much for your leadership and letting us know about those policies, dealing with the transportation pollution and emissions from trucks, especially those big trucks. And hopefully with electric trucks in the future, we'll be able to decrease it, with the new push from the Biden administration on
That's the goal.
climate crisis. But still, many people in our communities have asthma. And so we want to continue to hear ideas on how we can help with generating more policies to get access to better treatments and just education in general. Like everybody's been saying, the communities there in your districts are the worst, and they really need to understand that they can feel better and function better, have a better quality life. So we have one more assembly member office, and I have the pleasure to introduce Emmanuel Martinez, who's the legislative assistant from Assembly Member Yotk Tapia.
Hi, good afternoon. Can you hear me?
Yes.
Hi, it's a pleasure to be here. Just wanted to say I'm a representative for Yotk Tapia's office. So we're very adamant when it comes to resources to provide to our constituents. For one, asthma is one of the biggest concerns that the assembly member has, because we actually are next to a major highway, as you know, the Cross Runs Expressway.
Mhm.
One of the things we wanted to mention is that we are currently trying to just make it very known that the assembly member is working very hard to provide some sort of solutions and be supported in any type of way for asthma initiatives. For one, I believe Elizabeth hit it just right on the nail. Access to care, access to caring, knowing what is happening and what causes asthma in itself, and that is either environmental issues. In addition to that, not knowing, some parents or constituents of ours don't really know the triggers of asthma and how can that be caused. So we need more solutions to provide some sort of way to educate our constituents. So so that's what most of the stuff that we've been doing. And also the access to good quality air. So one of the things that the member had mentioned is like people are working, not electeds are working hard to look into how we can be very effective in capping the Cross Runs Expressway. But we also have to remember to work with our local agencies like Parks Department to try to push an initiative to have more greenery, like our trees, open spaces for our constituents to work with, so that we provide better air quality, and also mitigating some of the flow of traffic that can also cause higher levels of pollution. I'm very excited about it. I'm very excited to be working along with the member, because I myself also experience asthma myself. So I'm pretty much a fighter in that sense as well. So when it comes to asthma or anything regarding support towards that initiative, I'm definitely putting a bug in the ear for the assembly member to get her hands on to try to see if we can push that initiative to help more constituents who are dealing with these type of issues.
Emmanuel, you mentioned that you have asthma, so you must be very aware of how the medications and the treatment help you. Have you been diagnosed with severe asthma?
Well, yes. To answer, yes. I myself and my family sort of a victim of losing a loved one because of asthma, due to environmental issues, and lack of education and lack of access to medication. So that's one of the biggest things. Personally, some of our insurance companies doesn't necessarily cover some of all of the expenses for medicine. So we kind of, as legislators, we have to really pay attention to how we can increase access to some of our constituents. And we know that we need to be very helpful in that regard. So yes, to answer, yes.
Well, the reason I ask you, because I don't know if the other legislators understand the importance of these new medications that are coming out. We'd like to ask, what's the next step in your thinking about policies for asthma in the community? Obviously, to continue with school-based education and training, so the students in the schools get information, and then they can tell their parents too. So you kind of get 2 for 1 when you go through the schools. And especially with the kids that have asthma and know that they feel better when they use an inhaler in the right way, or they get the nebulizers, etc. But for people that have this severe asthma, Do you use epinephrine pens? And I noticed that was in the bill, so that was great to see the EpiPens. And do you use the new medications that have come out? And the reason we're here today is to talk about the future. How can we help policymakers have continue the asthma legislation to reach more of our community? Emmanuel, just want to know if you've used the newer medications that have come out.
So I have not used the EpiPen, so it has not gotten to that point, but I am currently on Symbicort. I've been utilizing that as a preventative. And that has been really helping me with the triggers of asthma. And it also prevents me from experiencing flare-ups. So
that's great. I just didn't mean to be so personal.
No, I understand the
Just
topic of the
thinking
nature of the conversation. Yeah.
How your policies can become more targeted to the people that really need more help. And you mentioned that there's a cost issue, and perhaps that could be the way to get help through the state funding, right, through Medicaid or through other ways. I don't know if the state policies include treatment when you think about sending funding to community clinics, for example, to your state community-based organizations that could get special funding for I don't know, discount treatment, let's just say. Have you thought about that? Anybody, the assembly members that were speaking, these questions are really for all of you.
Yeah, I think our goals is to reduce barriers all around. Any barriers present challenges. There are some, like in New York City, we have a program called New York City Cares that allows for all New York City residents to get healthcare coverage. We've partnered with them. We've done pop-ups. We've done education. But there's still people that don't enroll because they're not aware. And again, some of the most vulnerable communities are those who are ineligible for a lot of other programs or feel like they're ineligible, and there's a lot of fear. So like you said, Dr. Rios, like education is so important, and bringing these programs to the spaces in which our communities gather. I've done pop-ups in parks in the neighborhood after school. I've done them in the street. I've done them at like community fairs. I've done that at, any place we can get to the community, we try, but it is hard because many of our community members that are historically marginalized from healthcare, due to their status, there's just always so much fear. And we know at the federal level, we were fighting against a lot of policies, the charge, I'm forgetting the name of it.
Public charge.
Public charge, yeah, the public charge. And we, that was something that was a deep concern for our members. So I think the point is to try to push for as universal programs as possible and ensure access to the medications that everyone needs without cost. Ideally without cost, certainly affordable. So that's kind of like the larger long-term goal. There's a bill called the New York Health Act, which is our single-payer universal healthcare program. It's a little bit of a fight still, so we may not see it get passed into law in the immediate future, but certainly it's our long-term goal because it would reduce access for all people, increase access, reduce barriers for all people, and then ensure that medication and other treatments are accessible as well to all communities. And I apologize, I have to hop off, but I thank you so much. And I thank my other colleagues and all the experts, Dr. Ray as well, Dr. Lee Ray, for being here.
Thank you. Thank you, Assemblywoman. We appreciate your work. And let me just ask, is anyone else able to answer a couple questions? I just throw one out. The bills that have been introduced and passed with your introduction, your support as Latino politicians, along with your colleagues, have really focused on schools. Is there any thought about expanding the legislative efforts to after-school programs so that parents and teachers, you know, coming maybe to parent-teacher meetings can also get information. I just throw that out there because we've seen a huge difference that the school meal programs produced for, you know, changing the diet guidelines for school meals allowed, and this was just in the news, allowed the obesity epidemic to come down a little bit. And we also saw that whole families were getting meals during COVID from the schools if the families were eligible, you know, income-based. And I think in some places in the country, it's actually universal now for all kids in school, public schools, to get school lunch programs, because they know that students can actually be better at studying if they feel better, you know, and they're not on an empty stomach. And I would say the same thing with asthma. So just a quick question: do you think that that could be done to focus on schools, public schools, as a way to get funding in from the government, maybe some public-private partnerships to educate more of our communities about asthma as a, you know, as something that is very necessary, asthma treatment very necessary for those in need? Emmanuel, I don't know if you can answer that, or I see the other legislators are still on. Jason, can you help me with this? Are people on, or are they just left their names on the screen?
They should be here, Dr. Rios.
I'm sorry, I'm actually here. I'm sorry about that.
No, that's okay. I just saw the names and I just thought I'd ask the question while you're still on. Just a thought to expand on school-based programs that sometimes are a little bit more palatable than starting a whole new program. Just add to what you already have been successful at, right? To have more education for families, not just the actual student. For families in our communities that don't have the insurance to go to the doctors to learn about asthma treatment, and maybe, you know, when they feel better and they get an inhaler and feel better, they will go to clinics. You know, people just don't know their quality of life is decreased when they have asthma, can't breathe, yeah, etc.
Well, that is correct. As of now, in terms of your question, I don't have the answer to that, but I definitely will flag that question to the member so that you can get the correct answer.
Okay.
Mhm.
I
I'm not sure in terms of the other electeds. I don't want to speak on behalf of them.
I know I don't know who's still on. I see Michelle. I know you were there for Senator Rivera.
Hi there. Yes, I am the senator's legislative assistant. I don't have an answer for you, but I will drop my email in the chat to make sure that we can follow up with you. I do know that we do carry 2 bills, and like you said before, it is more school-based. I don't think we've thought about doing after school-based, but I think that'd be a great thing to do.
Okay, well, just, you know, just an idea. But thank you for that, and we'd be happy to follow up. So we do have another focus of this panel, and I want to thank all of the legislators that have been on talking about asthma. This is, I think, important for us as we think about access to care in our communities and Latino communities. We also think about the importance of having more diversity within the workforce. And I don't know if you all heard, but President Biden actually made an announcement today, a new executive order that's mandating all the federal agencies to focus in on hiring more and retaining more people of color, diverse people within all the federal government agencies. And so with us is Wilma Alvarado Little, the New York State Department of Health Director. And Wilma, I want you to take it away on your focus of health outcomes and how the workforce can make a difference, you know, to be trusted in our communities and to get more people to understand how much healthcare is important.
Sure. Thank you. Thank you so much for that. And I'm looking at the time, so I just want to make sure I stay within my time. So
Yes.
there's, you know, how can I, it's such a pleasure and a blessing to follow everyone who is so passionate about this work and realizes the importance of supporting our communities. And so what I'm going to talk about is some of the efforts that our asthma prevention program is working on. And then I'm also going to share some of the work from the Office of Minority Health and Health Disparities Prevention. Legislatively, our name was changed last year. Both houses approved the name change, and then the governor signed off. So technically we are the Office of Health Equity. However, we remain called the Office of Minority Health and Health Disparities Prevention. And so I'm going to start off by talking about some of the programs that are through our chronic disease and prevention arm of the department. My colleagues were able to provide information to share with you all today. So I'm not going to talk about the statistics and the data because, you know, we know this, right? We didn't need a pandemic for, at least I'll speak for myself as a Latina. I didn't need the data to tell me that my community is underserved or that we're hard to reach. We're not hard to reach, we're hardly reached. And so how can we continue to provide services to our communities? Because even though services may be available, that doesn't mean they're always accessible. And so with some limited appropriations directed to addressing asthma in children, that appropriation is 1.1 million. It's that's the total. It's nearly a 40% reduction since 2008. So with the monies that we have, our chronic disease focusing on asthma will fund a 5-year sole source contract launching on March 1st, 2023, right? So that's in a couple of weeks with the American Lung Association, who's going to work to expand the adoption of some approaches to improve asthma-related health outcomes and promote health equity and address some of the social needs among our children with asthma and their families. And let's not just think asthma, these are comorbidity issues as well. And so the initiatives that I'm going to talk very briefly about and more than happy to share offline are the asthma guidelines training. This is something that the American Lung Association is going to provide. They're going to provide extensive training and education options to build the capacity of New York State's asthma care team workforce. So that includes training on asthma basics, becoming a certified asthma educator, delivering home-based asthma services, and expanding guidelines-based asthma self-management education. Another program that falls under this appropriation is Project Breathe New York. And again, since the American Lung Association is the sole source for this funding, they're going to provide technical assistance on the adoption and implementation of a systems level quality improvement framework to engage health system and multi-sector community-based partners on how to deliver comprehensive asthma care. So it's coordinated again across clinical, home, school, and community-based settings, right? And the goal is going to be to reduce avoidable asthma-related emergency department and hospitalizations. So this is one of the other initiatives that we'll be working on, that they'll be working on with the American Lung Association. Another initiative is the New York State Healthy Homes Pilot, and that is a joint effort between the Department of Health and the New York State Energy Research and Development Authority, and they're supported by a large funding amount from the Clean Energy Fund. So this pilot aims to serve 500 households with one or more children enrolled in Medicaid whose asthma isn't well controlled. Interventions include comprehensive healthy home services, designed to produce energy efficiencies, reduce some of the energy costs, and improve asthma and home injury related health outcomes while reducing avoidable costs to Medicaid. So the implementation for this is currently underway with services currently being provided in New York City, including the Bronx, and in Western New York across 4 Medicaid managed care plans. Additionally, they're also in the process of piloting services to Central New York during 2023. Another initiative is the New York State Asthma Management in Schools and School-Based Health Centers initiative. So they're also going to facilitate partnerships with schools and school-based health centers to support the delivery of evidence-based asthma self-management education programming for students and supporting school and the school-based health center adoption of the guidelines, protocols, and policies supportive of students with asthma and also their families, right? Because it's not being done in isolation. And then there is a spotlight on delivery of home-based asthma services, and that was the Urban Health Plan. They also funded the New York State Asthma Control Program, and that was working with a federally qualified health center to provide this comprehensive care. So from March 2021 through February 2022, the Urban Health Plan provided home-based services for 366 individuals with asthma. And of this group, of those individuals, 32 identified as Hispanic Latino. And so, you know, with adequate funding, so much can be done to build capacity to serve all of New Yorkers, high asthma burden counties, to effectively focus on populations that are disproportionately burdened by asthma. And so some of these next steps are to be able to speak further about these offerings that we're sharing and priorities related to asthma in New York State. And so we continue to do this work. Now, in response to, you know, funding, the Office of Minority Health and Health Disparities Prevention does have some appropriations through our local assistance, our study of racial disparities, our minority male wellness, and our Latino health outreach initiatives. And each one of these appropriations are available to our communities to be able to apply for funding. One of the things that is sometimes daunting to our communities when they hear, you know, a New York State contract, right, or a state agency contract, is that, you know, they're expert in their communities. They don't need the Department of Health to go in there and say, okay, you all need to do this, that, and the other. They know what they need to do. What we need to do is be able to provide that support. So whenever we have an appropriation, and I don't like to call them contractors or vendors, they're our community partners. What we do is we walk them through the process because they're expert in their community. However, they hear Grants Gateway or SFS and that becomes paralyzing. So what my office does is we walk them through and we provide that guidance about, okay, let's break this down. This is how you do this. This is how you can apply for that. This is, you know, we're not going to be able to cover that under this funding appropriation. But what about this other piece that might be helpful to your community as well? So we have to be able to do that. And then one of the other things that we do when we're working with our communities is that we also include a health literacy lens. We also include a language assistance lens, and also a cultural competence lens. And so we ask that performance measures reflect these so that we can better understand how our communities are being impacted. Since we are a legislatively mandated office, right, created by Public Health Law 240, we do have a definition of minority area, which is 40% or greater non-white service population or county. And so this is the areas where we focus our funding, not to say that we will not work with others, we will, and we can, and we have. However, when we have a definition that's legislatively mandated as a minority area, this is where we're going to look at first. So we do have a mentorship in medicine program. And this is different from diversity in medicine because we are looking at pathway programs. I hesitate to use the word pipeline. We look at pathway programs that will identify our youth and help them understand that if you want to work in a hospital, there's so much more than being a doctor, a nurse, or housekeeping. There are other professions, and they really have the right to have an awareness of this. So that's one of the programs that we offer in order to engage our workforce and also to ensure that we're doing what we can to participate in the diversity in workforce so that we do have providers that resemble those whom we serve and whom we partner with. And so I'll go ahead and I'll stop there. Thank you, everyone.
Thank you very much, Wilma. You represent us well in New York, and we look forward to working with you too. I just wanted to say that you actually gave us a lot of different initiatives and hope you can let us know how they, the outcomes of those initiatives, and perhaps if there's any suggestions for the policymakers here on how they can help continue that support that you said was only a sole source contract. I'm assuming it's just a one-time thing. It's not a continuous prevention set of programs within the Department of Health.
Yeah, the asthma initiatives, yeah, that's a 5-year sole source contract. The initiatives through the Office of Minority Health and Health Disparities Prevention, those are annual. And we have worked with our community partners to either do a 1-year, do a 2-year, a 3-year, a 5-year, whatever works best based on, how the appropriation and how that information is obtained, right? So there's different ways if we have to do a sole source contract, if we have to do, if we just identify specific organizations that are going to meet a certain need that we're looking at. So the appropriations through the Office of Minority Health and Health Disparities Prevention, those at this time are annual. And we are in the process of evaluating some of our communities' proposals right now. So for example, we just finished a project in Westchester that's we just received information from their newspaper where they received some funding for a project that was called Tell Me Your Story. And what they're talking about is they convened the community to share their stories about how long COVID is impacting them. And so that was really well received, and we're truly appreciative to have had the opportunity to support that initiative within that area.
Right. Well, we're just here to understand how to connect the dots and how to be more more involved in advocacy with you all in New York. And again, I just want to thank everybody. Jason, don't know if you had more questions. I have a few questions here, but I think we've answered the majority of them. Wilma, I'll just ask one other question because
Sure.
it's part of our, we were hoping to get more information about this. So how can we increase the number of Latinos within medical schools and nursing schools? And is that something that your office is engaged in?
Yeah, so it's really interesting, and I think I'm walking a fine line because this is something that we've included. I've requested as a budget proposal, right? So I just want to preface that I'm responding to a question and not advocacy. Yeah. And so one of our initiatives is our mentorship in medicine and other health professions proposal. And so what we're looking at there with the appropriation that we have, it's tied to our legislation. We're looking to see how we can best support our communities with this. So in the past, we've worked with Arthur Ashe, we worked with Einstein School of Medicine. And what we've done is we've looked at, for Arthur Ashe at the beginning of this initiative when they were funded, what we did was we went into the funding supported high school students who were taking their PSATs. And so what we did was the funding was utilized to pay for those and also for any practice tests so that they can continue to prepare on how to get into university. Many of our children, unfortunately, start at a disadvantage because of the schools that they're attending don't have the resources that they receive. And that's a whole other discussion. So what the office did was provided funding for them to be as best prepared as possible to have that information. Other initiatives that have supported the mentorship in medicine is being mentored by an individual who is already in medical school or is a physician or a type of healthcare provider. And so this is something else, because if we don't see ourselves represented, especially in secondary education in our high school years, that's not going to be an incentive. And so these are the areas, these pathway programs where we can work with our community-based organizations who know their youth and see that they can receive some funds.
Yeah, I have to thank you for that. And I know how important it is to have mentoring, role models, and how important it is for students that are the younger students, high school, college students, to to even know that we exist.
Exactly.
So whatever we
Exactly.
can do to help with those types of programs. We actually have our own program. I don't know if you're aware of it, but our NHMA College Health Scholars Program. And we were able to meet with some of the legislators on the call today, last week, about the importance of supporting that type of program too, which is actually geared to, again, using medical students or doctors as mentors for pre-med students that are in college, or let's say nursing students and nurses for pre-nursing students that are in college that haven't gotten into these health professional programs or health professional schools. And so we're hoping that that can move forward with the legislators that we've been meeting with today. And I want to thank them for their interest and support too in these pathway programs. So Wilma, thank you for what you've been doing. I think that we're really about to wrap up in closing remarks. I'll just say that the National Hispanic Medical Association, again, is very interested in increasing our advocacy at the state level, especially with New York, because there's so many Latinos there and other underserved. So whatever we can do to work with the Latino caucuses in the Senate and the Assembly, we'd be happy to continue to help with getting more of our doctors to get involved. And I want to thank all of the legislators and the legislative staff that were here today. Senator Gustavo Rivera and his legislative assistant, Michelle Castellanos Ojeda, Senator Julia Salazar, Dr. Liz Lee, Assembly Member Kenny Burgos, and Emmanuel Martinez for Assembly Member Tapia, and of course, Assembly Member Jessica Gonzalez Rojas, and Wilma Alvarado Little, who's the Associate Commissioner, New York State Department of Health in the new Office of Health Equity. And I want to thank the staff, especially Jason and Chris, and our new Government Relations Director, Art, who's also on the call. And we'd be happy to support any of your legislative efforts around these issues, especially of access to care for our communities. But more importantly, today, we were really focused on the importance of reaching those who have asthma so that we can make sure they don't get to severe asthma. But for those who have severe asthma, we really know that there needs to be more education about the newest treatments they should be getting. And I think with that, I'll just stop. I want to thank you all again for being here. We have our national conference at the end of April in Chicago, and we will be discussing asthma there and other access issues, quality care issues, treatment issues. And I want to thank Amgen for supporting this webinar and our advocacy webinars this year on asthma. So thank you all very much.